And while Indian soldiers have been able to thwart the Chinese on the border, India's capital has fallen prey to the virus from China. Delhi is now officially the worst hit city in the country with more than 70,000 cases and counting. It is being compared to New York. To what does Delhi owe this new title? This report looks at all that went wrong.
New Delhi, India's national capital. The seat of politics, the military and the bureaucracy. Home to the most powerful people in the country. Now, the worst hit city by the Wuhan virus. With over 70,000 cases, New Delhi has surpassed Mumbai. In the last 24 hours, more than 3,750 cases have been reported. All these days, Mumbai held the infamous tag of New York of India. Now, New Delhi has won it. Authorities in both New York and Delhi are being accused of complacency. All the emphasis lay on capacity creation, and no attention was paid to contact tracing. Across the country, entire districts were being declared as containment zones. But the Delhi government insisted on smaller zones. There was no monitoring of people under self-quarantine. Delhi has twice the required number of accredited social health activists. That's over 3,500 ASHA workers who could be asked to follow up. To compound problems, several doctors at area-based clinics or mohalla clinics began to test positive. This led to the closure of at least 150 clinics. The Delhi government lost its local reach to trace cases, and with it, the ability to test more people. On May 27, the city did slightly over 6,000 tests per day. By June 7th, the number fell to 3,000. Blame it on the state government's move to stop testing asymptomatic cases. Delhi had close to 20,000 cases by the end of May. In the next 15 days, cases crossed the 35,000 mark. The Supreme Court pulled up Chief Minister Arvind Kejriwal for the massive spike. It posed one key question: why did the testing go down? The top court also questioned the lack of beds and why patients were finding it difficult to get admitted. More importantly, 3 BJP-led municipal corporations said the death toll is much higher than the government figures. Reports on problems with Delhi's death toll began to appear in early May. But it took a month for the Delhi government to set up an audit panel after the Supreme Court's rebuke. The central government took matters into its own hands and sent rapid antigen test kits. Nearly 40,000 cases have been detected in the last 2 weeks. Now testing has gone up from 5,000 tests per day to 20,000 tests per day. That's just half the battle won. The Delhi government expects cases to touch 550,000 by the end of July. Nearly 150,000 beds will be required to treat fresh cases. The government is converting trains, banquet halls and sports complexes into COVID-19 care centers. Delhi is finally doing what it should have done much earlier. More containment zones have been identified, taking the total to 263. In a week of intense contact tracing, door-to-door surveys will be carried out in these zones, covering 45 lakh houses. It has been rightly called the revised Delhi COVID response plan. Delhi's COVID-19 strategy badly needed a revision. Bureau Report, WION World is One.